About 7,000 foreign workers in Singapore have been moved from their purpose-built dormitories to alternative housing so far in the government's bid to break the chain of COVID-19 transmissions in the country. Now, the government also plans to put in place medical outposts in each of the 43 dormitories. Our reporter Deborah Wong joins us with more. So, Deborah, what's the interagency task force, what they've been doing?
Well, Glenda, we understand that it's a massive effort which includes 750 personnel from the healthcare clusters, armed forces, police and Manpower Ministry. So what they do is to provide medical support and also to inspect safe distancing measures in the dorms. Why this requires such a big effort is because we're talking about 200,000 workers living in 43 purpose-built dorms, and 95,000 of them live in 1,200 factory-converted dorms. So far, teams have been sent down to inspect these 43 dorms to stabilize the situation, making sure that the workers are housed in sanitized environments, that their well-being is maintained, even with safe distancing measures in place. So we know that 7 medical posts have been set up at the 8 dorms that's been gazetted as isolation areas, and there are plans to roll this out to all 43 soon. So over 600 factory converted dorms have also been inspected over a 2-day period, and the Manpower Ministry says that most are in compliance with safety measures. Now, on the essential workers, we know that 7,000 of them have been moved from the 43 purpose-built dorms to 18 locations island-wide, and they're being housed in government facilities such as those included under MOE, MINDEF, MPA, and even some sports facilities. So this is meant to make sure that these workers can still continue working and living in proper sanitized environments, but they still need to comply with safe distancing measures such as taking temperatures daily, and MOM did say that employers need to be responsible for this to make sure that they comply. Now, this also frees up space for medical support plans in the purpose-built dorms to set up isolation facilities, and the task force will be looking at how to reconfigure these places. They could be in terms of rooms or car parks. Let's hear what they had to say.
It is a 3-pronged strategy. First, in the dorms, where there are already clusters, we will actively contain the spread. Now, it means locking down these dormitories, no more moving in and out. Workers have to stay in their room as much as possible, minimize the interactions with other workers.
Deborah, how do authorities intend to separate the healthy away from those that are infected?
So when a patient reports sick at a medical post, and if he doesn't have any acute respiratory illnesses, he'll be treated and then be returned to the dormitory. But if he has symptoms, he'll be then sent to a swab isolation facility in the dorm, and he'll be placed there till the results are released. But if the results are negative, he will still be held separately. But if it's positive and if conditions are stable, he'll then be sent to community isolation facilities. But if the condition is not stable, he'll be sent to the hospital. So it's a strategy that needs all efficient response teams, and the task force is sparing no effort in rolling out the medical posts to the dorms. But their well-being is also a top priority. And in light of the Tamil and Bengali New Year, the Ministry of Manpower has actually distributed food treats to all 22 locations. Let's hear more from them.
We've put medical teams in the dormitories as well as additional teams for swab testing. And based on an active case finding, particularly in the dormitories where there are cases been reported, we've in fact been going in to look for workers who have even mild symptoms and to test them to determine whether or not they in fact have COVID-19. This allows us then to take them out of the dormitory, isolate them further, and therefore help to mitigate and prevent further transmission of COVID-19 within the dormitories itself.